Malusdomesticaphobia is the fear of apples, a condition that might sound unusual to some but can be genuinely distressing for those who experience it. This fear can centre around the sight, smell, taste, or even the thought of apples. Whether it's a fear of the texture, the possibility of choking, or an association with a negative experience, Malusdomesticaphobia can interfere with daily life in unexpected ways. Triggers for Malusdomesticaphobia vary from person to person. For some, simply seeing an apple in a fruit bowl can evoke anxiety. Others may be triggered by the sound of someone biting into an apple, or the sight of apple-based products like pies or juices. In more severe cases, the smell of apples or even images of them in advertisements can be enough to set off feelings of discomfort or fear. Reactions to this phobia can include physical symptoms like a racing heart, sweating, nausea, or an overwhelming urge to leave the situation. Emotional responses might involve feelings of dread, panic, or even shame, especially if the person feels their fear is not understood by others. Some individuals may avoid grocery stores or social situations where apples are likely to be present, which can create additional challenges. The causes of Malusdomesticaphobia often stem from a specific negative experience. This might include choking on an apple, an allergic reaction, or being forced to eat them as a child despite disliking them. Cultural associations or myths, such as the idea of a poisoned apple in stories, might also play a role in reinforcing fears. For others, the texture or crunch of apples might provoke sensory sensitivities that amplify their discomfort. The impact of this phobia can extend beyond just avoiding apples. It can influence dietary choices, making it difficult to eat in social settings where apples or apple-based foods are present. For those with severe fears, everyday tasks like shopping, cooking, or even watching TV commercials might become sources of anxiety. This can lead to isolation, stress, and frustration, particularly if the person feels their phobia is misunderstood or dismissed. Overcoming Malusdomesticaphobia requires patience and the right approach. Cognitive behavioural therapy, CBT, is often helpful in addressing the fear, allowing individuals to reframe their thoughts and gradually confront their triggers. Exposure therapy can also play a key role, starting with small steps, like looking at pictures of apples or being near them without needing to engage. Mindfulness and relaxation techniques, such as deep breathing or grounding exercises, can reduce anxiety in triggering situations. With consistent effort and support, it is entirely possible to manage this phobia, helping individuals feel more confident in navigating environments where apples might appear.